Hi, my name is Princess Osita Oleribe. I'm the Executive Director and co-founder of Center for Family Health Initiative. Center for Family Health Initiative is a non-for-profit, non-political, non-religious organization that is focused on improving community health, empowering women and girls, especially socio-economically. We also involved in research and policy development. I came into non-profit work over a decade ago. I had started off as a young child whose ambition was to be a doctor, and I think it's still there. Anyway, so I always wanted to help to change situations as much as I could. I remember an instance when my mother was really sick. She had pneumonia. It was really a bad attack. In the middle of the night, it felt like she was going to die. And I felt if only I were a doctor, I'll be able to do a lot to help her. But I've since learned that you can do more even if you're not a doctor. And so 13 years ago, when I was 7, the National Youth Service Corps, as a fresh graduate from the university, my friend and I were volunteering as peer educator trainers. That was at the point in time where the pandemic of HIV was really serious in Nigeria. And our task was to go train young people to train their peers on how to protect themselves from HIV and how their lives could become better for it. So we went around schools. We had over 100 students in our care. And when in one of those schools where we were going, we found that the children in a public school in the heart of town in Abuja didn't have any block of classroom to their name. So they would wait till the primary school would finish in the morning and they would come in the afternoon. And we felt this wasn't normal, this wasn't good. The children were not having the best environment to learn, considering how hot our climate is also. And so we as young graduates, no money to our names, no power, authority, but we felt we could do something. And so we wrote up our proposal as best as we could at that time and went out to the agency that was in charge of the school, UBEB, and we said, we want to get the blueprint of the school. We want to see what we can do as core members, what we could do to build up a block of classroom or 3 blocks of classroom, whatever the school can really function with. And they gave it to us, and we went around offices, individuals who wanted support. And eventually, to our own amazement even, we were able to build the first block of 3 classrooms in junior secondary school, Gwarempa. And we furnished the classrooms, and to crown it, on the day of the commissioning of the first block of 3 classrooms, the director of the UBEB, the chairman of UBEB, came in and said he was going to complete everything on the blueprint for the school, which meant the school would have a fence, water, electricity, more blocks of classrooms, chairs, and that was really amazing. What that taught us is that there's so much we can accomplish when we set out to do that. And in some ways, that snowballed to where we are today, to the work we are doing, trying to help young people in various communities to improve their health, to help them socioeconomically, and to see what we can do to generally better their lives. So as far as SDG, which is what I am talking about in this session, in Center for Family Health Initiative, we have worked in various communities. We have offices in 4 states of Nigeria, but we have worked almost across all the geopolitical zones in Nigeria. And as far as SDG 1, which is end poverty, we have worked with poor, vulnerable families to strengthen their household economy. So what that means is educating them as far as finances are concerned. That means providing them grants to support their businesses or to start a new business. It means even providing for them some kind of medical care or support that they need at the moment. It could even be accommodation support. It's so many things for these women that we make. But over the course of the past 3 years, we've been running a project which began initially as a work from Global Philanthropy Alliance. We use it to support poor women. Every year we do about 25 women and provide them soft loans that they can use to start businesses. But we just don't give them money. Sometimes we provide them this support in kind, so the materials they need for the work, and we follow up with them of teaching them what to do, how to do their businesses, and how they can recover their monies and be able to pay the soft loans. And we have had success stories. Women have paid back, but on the average, every year, 90% of the monies we give our comeback, and we feel really like we are making changes because we hear their testimonies.
Ina yin dinki, ina yin kasuwa, amma bai yi karfi ba kamar yadda su CFHI suka taimaka min. Na yi karfi lokacin da na sadu da su, don da na sadu da su suka kara bani karfi, sun bani kudin jari, suka bin kudi na siya injin nika, suka taimaka min kuma da biyan kudi makarantar yaran. Ina yin kasuwa wurin kuma ina biyan kudi makarantar yara. In ba dai tare da Allah da taimakon su ba, gaskiya ban san da yana nike ba, don abubuwa ba sauki na same su, amma da na same su komai yayi min sauki, da biyan kudi makarantar yara ko da abinci ko da sutura. Allah yana taimaka mana ta wurin hanyar su wannan kungiya din.
We also work in the space of SDG 2, zero poverty. We provide nutritional counseling, we provide nutritional demonstrations in the communities. We also teach people how to do home gardening, because a lot of times people think that all they need they have to get from the market. But when you don't have money to go to market, that becomes a problem. So we go into the communities and we teach them how they can garden in their homes and how they can use the available food stuff in their communities to have a balanced diet. And we're hoping in the near future to be able to work with them to have food banks so that foods can be available even when they're out of season. As far as health, this is a major part of what we do. So I started by talking about HIV work, but there's so much more we do with that. We have done HIV counseling and testing in communities where people live and work. And that means for us, we've tested over 500,000 people across different communities. We've referred them to care. We have supported them in their support groups. We have provided home-based care for them in their homes. We have referred them linked them up to other services where necessary. We've also worked with different partners to be able to provide care for mothers and newborns. MNCH work essentially. In Kaduna State, we worked across all the local governments in Kaduna State trying to provide low-zinc ORS treatment for diarrhea for children under 5 years of age. And infant mortality is a big problem in Nigeria, as we can tell. We've also worked in helping mothers to be able to get postpartum family planning such that we better our statistics in maternal mortality. We also work in the space of hepatitis, educating people, providing testing and counseling, referring them to care. We've been doing a lot of advocacy around health insurance. We believe that health insurance is essential for every human being. Catastrophic health expenditures can be intercepted if we have some kind of security for people to have healthcare when and where they need it. And so we've been campaigning for it with the people themselves, but with also their systems of support to say, rather than give this person a gift of 8,000, 10,000, you can pay it, and that becomes some security for their healthcare for an entire year. So far, we've had a few people enroll into the program. We're hoping to do much more with that. And while having talks of late with prisons management in Nigeria, trying to help them work on a health management system that will help them have information of all their inmates as far as their health statistics, so that they'll be able to know what care people need and where the gaps are. As far as education is a major part of the work CFHI has done, CFHI has over the years supported the education of over 6,000 children in the FCT. We provide them with educational scholastic materials.
By rescuing some of our students that are less privileged, by sponsoring them, taking care of their school charges, we don't have school fees, we have PTA charges, uniform, textbooks, and what have you. And I cannot know the exact number, but there are many.
The name of my school is Junior Secondary School, Biazi.
I want to be a medical doctor.
What I want to become in future is scientist. And my mommy don't have money to send me to school.
It's when CFHI came into my life. They started paying my school fees, and I'm so happy.
And up to today, they are still sponsoring. Though some have graduated from this school 2-3 years ago, they are now in senior secondary school, and I think they even follow them to that senior secondary school. I know about 2-3 of them, like Emma was our head boy 3 years ago, and is now in a government secondary school, Buhari. Ogadima is now in government secondary school, Beaji, and likewise Hikima, she's also in government secondary school, Beaji, and I think they even paid for their WAEC and NECO for this 2019.
CFHI, I'm grateful for what they do.
We also have a resource center here, which serves like a library. Unfortunately, we don't have a lot of libraries. Students can come study in, so we provided a space for that. And they also have access to computers and internet in that space. And they have textbooks that we've made available to help better themselves. We have also set up clubs in the schools where we go in, but our clubs are usually around health, but also life skills for these young people in schools.
I'm still appealing that they should not relent in their efforts to still come to our aids. We still have some less privileged students that need their assistance. And I'll beg this organization to please try. Maybe we'll write to them so that they will come and see these children, meet with their parents. So that if there's any way they can help, I'm still appealing so that they can still help them the same way they help other students. May God continue to reward them and uplift the organization. Thank you. God bless.
As far as gender, we've done a number of things in gender. We worked on a project supported by the U.S. State Department that enabled us fight against some of the gender-based violence issues that we have, maltreatment of people because of their gender. So where you talk about female genital mutilation, where you talk about harmful widowhood practices, or we talk about child marriages. This project was actually in Imo State. We were able to reach over 700 women. We were able to work across all the villages in that particular community. In the end, we had the paramount traditional ruler sign a charter saying FGM, female genital mutilation, was abhorred in the community, and there were punishments. They talked about also other punishments for early marriage and harmful practices against the women folk. We are also working presently to try to fight gender-based violence. We've sent out a lot of applications around to solicit support for a call center that will help people discuss their issues anonymously, that will help them report issues, that will help us also in a lot of ways prevent gender-based violence. We're hoping that that comes through soon enough. But we have worked in communities also providing safe spaces where women can talk about their issues. This is called Gender Circle. So in the communities, we have groups of women in small settings where they gather according to their a homogeneous group, say of the same age, of the same vocation, of the same social status, some things like that, that enables them talk in those spaces to air their own opinions, which ordinarily would be difficult for them in a place where people who don't belong to that group is. As far as sanitation, clean water and sanitation, we've worked in a number of communities and a number of schools. In the schools, we have been campaigning for toilets. Now, open defecation is a big problem here in the country. I read recently how Nigeria is like the second worst in the world, and a lot of public schools we have don't have functional toilets, and you have hundreds of children in those schools and they don't have toilets to use. Recently, we renovated two blocks of toilets in a school in Abuja where children could use toilets during school hours. And when we did, we found that another problem arose. They didn't know how to use the water system. So we had to go back to teach them how to use the water system. We had to provide water because water was a problem for the school. So how would you use the water system if you don't have water? And so these are things we're passionate about and we've been working very seriously around. We also have looked at the issue of menstrual hygiene, menstrual health and hygiene management. A lot of the girls we work with are girls who go to public schools, and a lot of people in that space are people who are not able to support themselves, and so trying to take care of themselves and their monthly cycle becomes a problem for them. So we got into alliance with a company that produces washable sanitary pads, which is highly hygienic because it has microbicides that helps the girls stay healthy even when they don't have the best, cleanest of waters to wash the sanitary pads. And so we don't just give it to them, but we go to the schools, we do an analysis of who needs what, and we educate them about their cycle, about their sexual and reproductive health. And we also give to them the kits for their monthly cycle. So far we've gone to, I think, 6 schools, but we're hoping to do much more than that. Now, I know it sounds like, why am I hearing all this? What can I do? It goes back to where I started. There's so much we can do if we try, right? So if you had $100, you'll be able to provide healthcare for a family of 4 for a year, as far as the community-based health insurance scheme that we are working on in Imo State. To wrap up, let me take us back to where we started. We can do a lot if we try. If you had $100, you'll be able to put a child in school for an entire session. Nigeria has over 13 million children out of school. If you had $100, a child can be in school, have tuition paid, have scholastic materials for an entire year. If you had $100, you'll be able to support a household start a business or support an existing business, which means food on their table, which means healthcare for their children, which means reduce gender-based violence, as we have seen in the course of the work we do. If you had $100, you'll be able to provide 20 girls reusable sanitary pads for 3 years. If you had $100, you'll be able to provide health insurance for 3 individuals in the community-based health insurance scheme that we have. If you had $100, there is so much you can make happen. And sustainable development goals means that no one is left behind. We're in a global community. What happens in Nigeria affects every other person in the world. With the way communication happens, with the way travels happens, it's all of us involved in this, and we can all be part of making the change we want to see. Please support us. Thank you.